It's been a memorable few weeks for the newly appointed Whanganui District Health Board member, Mary Bennett, but the appointment has been a long time coming. The position vacant since early last year.
It's been a really busy year. So if you think back to March last year, we were in COVID. And as you would expect, a government has different priorities when it's looking at the health of the nation. And so we've just been patient, and I got the letter of appointment from the Minister's office, the offer of appointment on the eve of the announcement of the health reforms.
The details of what exactly the health reforms will look like are not clear yet, but changing current statistics is a priority.
For Māori, the conversations that everybody is having at the moment is, what does this look like and what do we want to see over the next 10, 20, 30 years? How will we know when the system is delivering for our people? And one way we will know is that the statistics will change dramatically.
One thing that could bring about change is the $242 million allocated in this year's budget for the establishment of a Māori health authority.
Where we're going in terms of health reforms, we know that the current model, the current system isn't working for everybody. So finding out the why and being able to provide a solution that is right for the various communities that we have in our wider rohe is really important. Some of the things that we do know, and we take the learnings from last year's COVID response, going to the people makes a big difference. We don't want to have a system that continues to be illness driven.
While statistics aren't expected to change straight away, long-term collaboration between government services looks set to play a big part in the future of preventative healthcare.
If you think about underlying health conditions, then those things aren't going to change overnight. Some of these things are absolutely going to be intergenerational, but we have already seen examples of how various systems can come together to deliver a service in a more holistic way. Really good examples during COVID, during our lockdown. So what we saw in health was a whole lot of different providers, the District Health Board, various parts of the regional health network come together to deliver vaccinations, flu vaccinations and immunisations to the public, not getting everybody to go to the hospital, but actually setting up little centres all over the place so that people had somewhere to come. I think also it's not just about health, so health is often the outcome of a lot of other things happening in the environment. So education, when we think education, we automatically think schools and universities and polytechs, but education might be just letting the house next door know that actually this is what you're entitled to receive.
Accessibility to healthcare is under consideration too. COVID-initiated efficiencies like telehealth likely to play an important part in how future health services are delivered.
Need to come in for an appointment, this is how I'm feeling, and okay, so our preference is that you stay home, and can the doctor ring you? Yes, I'm fine with that. They can ring. 2 to 3 minute conversation, and I had a prescription on its way to a chemist, and then I could go and pick that up later in the day. So it's amazing how quickly we can go from, no, you have to come in to see your GP, it's going to take it's a 15-minute consultation before you get anything, to actually, here's the symptoms, everything that's going on, okay, I'll send a prescription through. That's a very different way of doing things. And absolutely, it might be as a result of COVID that a whole lot of those things have had to be introduced at that time, but actually there are efficiencies to be gained in there.
For now, the demographic of each area and each community's individual needs are all under consideration.
Thinking about where our communities are and what they might need. So the need in the middle reaches of the river could be very different to the needs at the lower reaches. The needs in Waverley, where we have an older retired population, majority actually non-Māori, but the need for the community could be quite different to the need in the middle of the reaches of the awa.
A return to community, growing kai, tikanga and learning traditional practices through wānanga have also been hot topics.
The health reforms are a great opportunity for Māori, for iwi to show how things can work differently. I think that we can't forget that the Health NZ will also have a responsibility in terms of equity. So while for Māori by Māori, one building and then being able to deliver on that, but at the same time being able to hold to account the rest of government for delivery on its obligations to the New Zealand public, really. Because we will have some people who are engaged with iwi, engaged with Māori, who absolutely know who they are, but what about those who don't and who aren't yet? So the opportunities to bring those together. I think also within Health NZ we have to think about other ethnicities, and we have to think about things like disability, things like homelessness. So what does healthcare look like for all groups?
The current DHB system will be scrapped in June 2022 to be replaced with a new public health agency under the Ministry of Health, alongside the Māori Health Authority, with reforms to be hazed in over the next 3 years. Georgie Ormond, Local Focus.